Welcome to today's lecture on the comprehensive assessment of the nose. As future medical professionals, it is crucial to have a thorough understanding of the various examination techniques and evaluations used to assess nasal health. In this lecture, we will cover topics ranging from external inspection to nasal endoscopy, smell disorders, and nasal surgical procedures. By the end of this lecture, you will have a comprehensive understanding of how to assess the nose and diagnose related conditions. Let's begin with our first topic, nasal inspection and palpation. The assessment of the external nose involves a careful examination of its structure, looking for any asymmetry, deformities, or abnormalities. Palpation is used to evaluate tenderness, bony prominences, and overall contour. By observing any external changes, we can better understand potential underlying conditions affecting the nasal passages. Moving into the nasal cavity, we shift our focus to the nasal mucosa. Here, careful examination for signs of inflammation, congestion, polyps, or bleeding can aid in the diagnosis of conditions such as rhinitis or nasal allergies. It is important to pay close attention to the color, moisture, and texture of the mucosa, as changes may indicate underlying pathologies. The nasal septum plays a critical role in maintaining proper airflow through the nasal passages. By assessing the septum for deviations or perforations, we can identify potential obstructions that may affect breathing. It is important to note any structural abnormalities and assess their severity to determine if further intervention, such as septoplasty, is necessary. Assessing nasal airflow is essential in understanding the functionality of the nasal passages. By utilizing techniques like rhinomanometry or acoustic rhinometry, we can measure the resistance and volume of airflow through each nostril. This evaluation helps identify any asymmetry or obstructions that may impact breathing and require intervention. The sense of smell, or olfactory function, is crucial for detecting potential dangers or experiencing the full range of sensory experiences. By employing scratch and sniff tests or odor identification tests, we can assess the olfactory function and determine if any abnormalities or impairments are present. This evaluation aids in diagnosing conditions such as anosmia or hyposmia. Moving beyond the nasal cavity, the evaluation of the paranasal sinuses is an integral part of the overall nasal assessment. Utilizing palpation and inspection techniques, we carefully evaluate for tenderness, swelling, or deformities in the sinus regions. Any abnormalities may indicate sinusitis, sinus polyps, or other sinus-related conditions requiring further investigation. Nasal endoscopy provides detailed visualization and examination of the nasal cavity. Using either flexible or rigid endoscopes, we can thoroughly assess the nasal turbinates, meatuses, and nasopharynx. This technique allows us to identify any lesions, tumors, or other abnormalities that may require additional diagnostic procedures or treatment. Allergic rhinitis is a common condition that affects a significant portion of the population. By recognizing clinical signs and symptoms such as sneezing, itching, and nasal congestion, we can suspect allergic rhinitis. Performing allergy testing, such as skin prick testing or blood tests, aids in identifying specific allergens and developing appropriate treatment plans. Rhinoscopy is a diagnostic technique involving the use of a rigid endoscope to thoroughly investigate the nasal cavity, nasopharynx, and nearby areas. This procedure allows for a detailed examination, aiding in the early detection of tumors, foreign bodies, or other abnormalities that may require immediate intervention. Loss or impairment of the sense of smell can significantly impact an individual's quality of life. Through various olfactory testing methods, we can diagnose conditions such as anosmia, complete loss of smell, or hyposmia, reduced sense of smell. Identifying underlying causes, such as viral infections, trauma, or neurological disorders, enables appropriate treatment approaches. Nasal trauma can result from accidents, sports injuries, or physical altercations. When assessing nasal trauma, it is essential to identify potential fractures, septal hematomas, or other traumatic injuries that require immediate intervention. Prompt treatment can prevent further complications and ensure proper healing. Understanding the indications, techniques, and potential complications of common nasal surgical procedures is crucial for medical professionals. These procedures, such as septoplasty, rhinoplasty, or sinus endoscopy, aim to restore nasal function, improve aesthetics, or address underlying conditions. Gaining familiarity with these procedures ensures informed decision-making and proper patient care. To sum up, a thorough nose examination includes evaluating different aspects such as external inspection and surgical procedures. This helps identify abnormalities, diagnose conditions, and develop treatment plans. It is vital for future medical professionals to master these techniques for optimal patient care. Thank you for your attention, and I encourage further exploration and practice of the skills covered.